I'm Dr. Sam Mann, and this is Beyond Conventional Medical Thinking. And the topic today is very much beyond conventional thinking, and the topic is an important and common one, and it's about chronic anxiety and various forms of anxiety. In today's talk, I'm going to offer a different approach that is truly different from what's out there, and I think it's important, and see what you think. I'm going to discuss a treatment that can be effective in treating anxiety disorders and that is usually well tolerated, yet is almost never prescribed or even considered by psychiatrists or physicians. I think it could play an important role in the management of this very symptomatic condition, and that it's important to get the word out about it because there are so many people who are being treated for chronic anxiety and who continue to suffer either from the anxiety or from side effects of the widely used medications. So let me start out by making it clear. I am not a psychiatrist. Patients come to see me about their blood pressure, not about their anxiety. But over decades of seeing thousands of patients, I of course saw patients who are also suffering from chronic anxiety, generalized anxiety disorder, ADHD. And I noticed something that very few doctors were aware of, and that is a safe, inexpensive, and usually well-tolerated medication that I was prescribing for blood pressure, and it turned out to be very helpful with regard to the anxiety. A medication that very few doctors or psychiatrists even consider prescribing for anxiety. It's not even listed as an option. Anxiety is a normal emotion. Life challenges us. We all transiently experience anxiety, but about a third of the population suffers from anxiety beyond that. And about 6 to 8% of the population suffer from persisting anxiety, which can persist for decades. Many are treated with tranquilizers or antidepressants or both. Those are the main treatments. There are additionally other treatments that are tried, but those are the main ones. And many remain untreated or inadequately treated. Many suffer side effects from these medications. The tranquilizers such as Xanax, Ativan, Valium, they're helpful, but people can become dependent on them. And it can also be a bit unsafe when driving. Antidepressants such as Lexapro, Prozac, and others, they can cause weight gain or other side effects. And again, they don't always help. So what am I suggesting as an alternative? And how did I become aware of its benefit? Again, I am not a psychiatrist, and patients didn't come to me to deal with their anxiety. But some, in addition to their high blood pressure, were also suffering from anxiety. And I decided to try what we call an N of 1 experiment, meaning when we as physicians are treating patients who are not doing well on their medication, we try something that's not necessarily in the books, but that it makes sense. And if it's safe, why not try it? As physicians, we learn a lot from clinical experience, things that are not always in the books and might never be formally studied, and that's a problem. I decided to prescribe a beta blocker for the high blood pressure that these patients had. They're usually not prescribed as a first step drug for ordinary hypertension, but hey, let's try it. And when those patients returned, many of them told me their anxiety was much better and remained better. In many, the improvement was truly substantial. So, how does the beta blocker reduce anxiety? And here's why I think it's a logical alternative in treating anxiety. And importantly, it doesn't target the brain at all and doesn't have side effects in terms of cognition or anything. So when someone suffers from anxiety, what's the hormone that is secreted that contributes considerably to the anxiety? Adrenaline. Your adrenaline is pumping, our fight or flight reflex. Well, Beta blockers, among their effects, inhibit the secretion of adrenaline. When you think about it, it's perfectly suited for people suffering from chronic anxiety who are secreting adrenaline all the time. Why not try it? I think it's a no-brainer, yet it's rarely considered. But if it works, it can enable some to reduce or eliminate lifelong treatment with an antidepressant, which can have side effects, or with the tranquilizers they take, which can lead to dependency. So it is beneficial to consider this as an alternative. If it doesn't help, or if there are side effects, one can simply stop taking the beta blocker. I'm not saying it'll help every patient, but I think it can help many. And for some, it can even be life-changing. And I think it can be a breakthrough for many who are suffering from chronic, relentless anxiety. What percent will benefit, will get the response? My first answer is I don't know. There is very little published data about its use for chronic anxiety. Studies were performed decades ago, did not demonstrate clear benefit, and I think that discouraged their use. But my experience tells me that it helps a significant proportion of patients. And when it does work, it can enable reduction or even elimination of the need for antidepressants and tranquilizers in some patients. So here are the advantages of trying a beta blocker. It looks like it works in a significant proportion of patients. It's inexpensive. It's safe. Yes, there are certain precautions, and I'll get to that in a few minutes. And here's the gigantic advantage that makes it worth trying. Unlike the antidepressants, which can take weeks to determine if they're going to help or not, with the beta blocker, you will know within a couple of days. You don't have to try it for weeks or months, just a few days, and you'll have your answer. So why has this treatment option received no attention? A few reasons. One, of course, was in those studies done decades ago. It did not show benefit, and we'll get back to that. Two, the beta blockers have been around for decades. They are generic medicines. They're not expensive. No drug company is going to make much of a profit doing the massive studies and promotion to get it off the ground. They're not going to do it. The beta blocker propranolol gained fame for anxiety, but it was for short-term reduction of performance anxiety. What about for long-term generalized anxiety? Studies were done decades ago to examine this. In terms of the studies, there was a review of 44 studies, and it did not show benefit, but its conclusion was also there was not enough data. There was not enough good data in the literature to reach any conclusion. More studies were needed. So my experience with patients tells me that a beta blocker can often be helpful. So then why didn't the study show it? One reason is that most studies looked at the beta blocker propranolol. Propranolol's blood level after a given dose can differ tremendously from one person to another. You don't get a predictable blood level. Some patients could get an inadequate level, some could get too high a level, and side effects. So I don't recommend propranolol. I also don't recommend the two current best-selling beta blockers, metoprolol, otherwise known as Toprol, or carvedilol, otherwise known as Coreg. The one I will recommend has pharmacologic characteristics that are superior to these drugs, and that my clinical experience teaches me is worth trying, and I'll get to that. But the drug that I will get to was not marketed well and did not become a big seller. I don't recommend metoprolol because, like propranolol, it's metabolized at a different rate in different people. A given dose can give you a blood level anywhere from 20 to 200, the same dose. Carvedilol, at its recommended dose, is not that effective for blood pressure. It's too low a dose. And there were concerns about marketing a higher dose, so it wasn't. What is the beta blocker that I like? Bisoprolol, BIS, bisoprolol. I like it because it provides a more predictable blood level and also has other advantages. What dose do I use and recommend? Usually I suggest starting with a low dose, 2.5 milligrams once a day. If that works, you can stay on that lowest dose. And the good news is you'll know within a day or two. And here's the strategy you can use. And again, after discussing this with your doctor, if your anxiety is better on the 2.5 dose, stay on it. If it isn't better, should you increase the dose? Here you can use your pulse rate as a guide. Beta blockers lower your heart rate. So checking your heart rate is an indicator of whether the dose you're taking is having an effect. If your heart rate has not slowed at all or minimally, then you can usually increase the dose to 5 milligrams once a day. Here again, if it helps, great. If after a couple of days it doesn't help the anxiety, but the heart rate didn't slow down at all, you could try 7.5 milligrams. You could go higher, but I don't prescribe 10 milligrams to many patients. If it's going to help, usually the 2.5 or 5 are going to work. Now, if you didn't feel better and your heart rate dropped from, say, 75 down to 60, then it's probably not going to help. I would not try a higher dose because you have evidence of beta blocker effect, and I would just drop it. It's probably not going to help. Can you try bisoprolol if your heart rate usually is low, say in the 50s? Most patients with anxiety don't have a heart rate in the 50s, but if you do, I probably wouldn't try the bisoprolol, the beta blocker. Another question which needs to be asked is bisoprolol safer and kinder than treatment with an antidepressant or a tranquilizer or both? I think it is, both because the antidepressants and tranquilizers have their unwanted effects. And again, as I mentioned, the risk of becoming dependent on tranquilizers. Next question. Beta blockers are widely prescribed for hypertension, high blood pressure. Is it safe to take it for generalized anxiety if you don't have hypertension and if your blood pressure is normal? My answer is yes, it usually is safe. Considering that millions of patients with a normal blood pressure do take a beta blocker for problems other than hypertension, such as coronary heart disease, arrhythmias, and others, where their blood pressure is normal. And so it is tolerated without, usually without a drop in blood pressure. But it should be prescribed if your pressure is normal under the supervision of a physician, just to make sure. Are there possible side effects to be aware of? Most patients don't have side effects. Some do, and you can discuss this with your doctor. Possible side effects? Unlikely, but it can worsen asthma. If you have significant asthma, I would not recommend this. It can cause a very slow heart rate, but even if it slows down to the 50s, generally that shouldn't be a problem. And it can lower your blood pressure, but usually blood pressure is all right, but you should check the blood pressure once you start it. Most patients don't get the adverse effects, but again, you have to discuss this with your doctor. So to sum up, I've described how, in my experience, the beta blocker bisoprolol has had a helpful effect in patients who had chronic anxiety. Unfortunately, it will never be formally studied with large studies to document it, and it will not be promoted for use like all the TV ads we see every day. It will not be promoted for use for anxiety. And very few physicians will even think of prescribing it. And that's why I'm bringing it to your attention, because it's you who will have to bring the suggestion to your physician or psychiatrist. And again, if you have the anxiety and it's not doing well, hey, it's worth a try. Again, under the supervision of your physician. So to conclude, the beta blocker, the bisoprolol, often is helpful. It is reasonably safe. You might be able to reduce your need for tranquilizers and antidepressant medication, again, under the supervision of your physician. And very important, this is so important, You will know within a couple of days. I'm not asking you to try it for weeks. And that is so important. If there are any adverse effects or it's not working, you'll be on and off it within a few days. And that makes it even safer. So if you or someone you know is suffering from chronic anxiety and their medication has not adequately helped, or they're having side effects from their anti-anxiety medication, trying a beta blocker, and in particular bisoprolol, may be worth a quick try. And let your friends and family know, because it's so easy to try. You'll know quickly if it's helpful or not, and it might make a big difference. Try it under the supervision of your physician or psychiatrist. And again, I want to be clear, you're going to have to suggest it to them, because it won't occur to them to try it unless you suggest it. If your physician has any questions, I'm very willing to communicate with your physician or psychiatrist. So those are my thoughts. And I'd like to ask one favor. If you try it, please let me know through my website whether it helped or didn't help. And if I receive enough responses, I'll communicate those results on a future episode. Thank you, and be well.